Usually the first symptom of scleroderma is the development of Raynaud's phenomenon, and this is a temporary disruption of blood supply to the extremities, and that's triggered off by changes in temperature or emotional stress. Now, if I was to stick my hand in a bucket of cold water, the blood vessels around my hand would shut down to try and conserve heat, and my hand would go cold and white. The problem in Raynaud's phenomenon is that it happens very small changes of temperature or in situations of stress. Raynaud's phenomenon itself isn't necessarily abnormal. It's very common, particularly in young girls. It can come on in teenage years, and some people believe that up to 1 in 10 people can have Raynaud's phenomenon and actually not be unhealthy. We tend to worry about this though when it comes on as an adult. When this happens, it may be the first sign of a connective tissue disease such as systemic sclerosis or scleroderma. In this situation, I think it's helpful to get checked over by a doctor to see whether there are any factors that might link it into scleroderma. And when we look at patients with adult onset Raynaud's phenomenon, the things that we're looking for are, there's a variety of issues. First of all, are there any symptoms or findings on examination that might suggest a connective tissue disease such as systemic sclerosis or scleroderma? We also want to do some simple blood tests to see whether there are any autoantibodies that can be linked with systemic sclerosis. And also some other things such as doing a special X-ray around the neck to see whether or not there can be any trapping of blood vessels as they come out of the chest into the arms, because rarely they can be associated with Raynaud's phenomenon. So Raynaud's phenomenon as a youngster is usually nothing to worry about, and only a tiny number of people that develop it young will go on to get connective tissue disease. But when it develops as an adult, then there's a higher chance of it being the first sign of a connective tissue disease. Still, it's only a minority of people that will go on to get that, but certainly we want to investigate it to keep an eye on people and try and detect the development of a connective tissue disease at an early stage. There are many different forms of scleroderma. Essentially, it can affect either just the skin or it can affect the whole body as well as the skin. The scleroderma types that just affect the skin can sometimes involve just small patches over the skin, and that's called morphea. But the systemic form of the disease can be associated with problems inside, such as problems in the heart or the bowel or the lungs. And the systemic form of the disease we tend to break down as either skin problems affecting most of the body or just the extremities. The form that affects the whole of the body is called diffuse cutaneous scleroderma, and the part that affects just the extremities is called limited cutaneous scleroderma, and that in the past has also been called CREST syndrome. The most common symptom of systemic sclerosis, and usually the first one that occurs, is that of Raynaud's phenomenon. However, patients can also notice other things which are associated with the disease. It may be that they notice the skin feeling tight or puffy or a little itchy, or it may be that they notice symptoms from other organs that are involved, not just the skin. For example, there can be heartburn with the esophagus or gullet being involved. There could be problems with diarrhea or weight loss, or even constipation as other parts of the gut get involved. And some patients feel very run down and tired.